The air-water syringe is one of the most important and frequently used tools in the dental operatory. Used in a variety of procedures, it delivers a steady stream of air, water, or a mixture of both that allows the dentist and staff to rinse and dry areas within the oral cavity. However, the traditional all-metal handpiece system has both hygiene and maintenance issues that potentially have a negative impact on patient health and can be disruptive to office workflow and productivity. Today's dentist can choose between traditional metal syringe tips or disposable tips. Metal tips are durable, but because of their tiny interior passages, they cannot be effectively cleaned. This lack of cleanliness can result in incomplete sterilization in the autoclave, leading to potential cross-contamination issues in the dental setting. In addition, metal tips cause certain types of wear in the handpiece that can reduce performance. Disposable tips reduce cross-contamination issues and save processing time, but the most common disposable tips are known to create ongoing maintenance problems. Now, there's an air-water syringe tip that combines the best of both worlds. Seal-Tight by TotalCare is a single-use air-water syringe tip that offers excellent performance and reduces the risk of cross-contamination in one easy-to-use system. This module will introduce you to Seal-Tight and show you how its patented technology sets it apart from every other air-water syringe tip currently on the market. Seal-Tight is the disposable air-water syringe tip that delivers dry air on demand. The only syringe tip with a unique technology designed for rapid and secure tip replacement, Seal-Tight features an inner yellow rubber seal that acts like a new O-ring with each tip replacement, ensuring dry air with every use. Seal-Tight tips are easy to remove and replace. They're flexible enough to be bent at a 90-degree angle without affecting water flow, yet rigid enough to easily retract the lips and cheek without bending. And because you replace the tip after every use, you reduce the risk of cross-contamination among patients and staff. Seal-Tight tips require the use of a specific adapter that attaches to the syringe. Once the adapter is installed, replacing a Seal-Tight syringe tip is a snap. Simply push it into the adapter with one motion. To remove the Seal-Tight tip, push the yellow locking ring back to unlock it and pull on the tip. Seal-Tight makes adapters to fit all ADEC, DCI, and press ring style syringes. Undesired water in the airstream is a frequent problem for both metal and plastic tips. As a result, many clinicians have developed the habit of spraying the initial blast of air off to the side before taking the syringe to the oral cavity for procedures. Seal-Tight eliminates this step with its unique interlock system that eliminates wear and tear at the insertion point of your air-water syringe. This ensures a fresh seal with every new tip and provides dry air on demand every time. In addition, metal syringe tips must be sterilized after each use, which takes time, increases costs, and reduces staff productivity. Yet, even after repeated autoclaving, encrusted oral matter and potential pathogens can remain inside metal tips, presenting a constant risk of cross-contamination. Because Seal-Tight air-water syringe tips are disposable, they provide maximum protection from cross-contamination while eliminating the time and cost involved in sterilizing traditional metal tips. The Seal-Tight system eliminates the need to change the tiny tip O-ring, which is known to wear quickly, resulting in water contaminating the dry airstream. With Seal-Tight, the adapter is permanently installed into the air-water syringe. When you insert a Seal-Tight tip into the syringe, the soft material on the inside of the tip squeezes the stinger inside the adapter, acting like an O-ring, completely sealing the water passage. Because the soft material is in the tip, which gets changed after every use, the water-sealing surface can't wear out. eliminating the chance of leakage. With Seal-Tight, water leaking into the air passages and expensive service calls to replace the O-ring are things of the past. In clinical evaluations, the dental advisor gave the Seal-Tight disposable air-water syringe tip system a 94% rating and highly recommended it for all phases of dental treatment. The CRA newsletter, which compared 4 disposable plastic tips in lab and clinical tests, gave Seal-Tight an excellent rating for air dryness and a very good rating for ease of installation and tip removal. Test results found 0% water in the airstream and 0% loose tips. In comparison, the competing syringes reported problems with water in the airstream 17 to 33% of the time. Seal-Tight was the only tip in the study to earn a good to excellent overall rating. The only syringe tips that ensure dry air the first time and every time, Seal-Tight tips are flexible enough to service difficult-to-reach areas, but rigid enough for cheek retraction. They minimize cross-contamination by using a new tip for every patient. They eliminate the time and expense of autoclaving tips and replacing worn-out O-rings. And you get dry air on demand every time, which leads to fewer restoration failures due to improper bonding. For a superior solution for all your air-water syringe needs, get the Seal-Tight disposable air-water syringe tip system from TotalCare.